To see all the details on what happened to me, video documentation at YouTube channel My Medical Nightmare. Alright, so the past summer bore witness to the antics of Neuro-Spine surgeon and medical doctor Ara Deukmedjian. His clinic is the Duke Spine Institute located in Florida. He was recorded in a video uploaded on June 6, 2025. In this you can see that in the midst of a surgical procedure, he launches into a verbal tirade against his assistant, a nurse, and the rest of the operating team. This is absolutely outrageous, unacceptable behavior for a medical doctor of Deukmedjian's standing to be involved in. Following this, the internet lit ablaze with the rage and indignation of viewers around the world. 205,000 views, 1.8 thousand comments, and 1.2 thousand reactions as of October 28th on the Space Coast Rocket Facebook page. I myself was damaged to a far greater extent when I had a 2022 video consultation with Deukmedjian, and this was recorded. You can see it among my 100 hours of video on my injury. This doctor tried to mislead me. My time was wasted, and I believe he possessed credentials to acknowledge the serious head trauma-based broken skull injury that I had that showed up in those MRI pictures I sent him to review, and he chose not to. Alright, so update. Meanwhile, while all this is going on, a lot of people don't realize that Dr. Deukmedjian has dabbled in motion picture film production. Just a few weeks ago in September 25, there apparently was a premiere screening for a movie that he was involved with called Spine Scam. Yeah, there's some posts on social media about the premiere, possibly in the city of San Diego. This was directed by Jeff Deverett. Deukmedjian is listed in the credits as a writer and executive producer. My belief is that Deukmedjian financially backed this movie to some extent as well. The premise of the film is rather interesting because as a patient consulting this doctor, I found myself in a situation where I believe the doctor failed to do his job and inform me of a legitimate injury and concern. So the real question is, who's scamming who out there? And I believe you can watch the entire movie on YouTube. Just search the title. Haven't had a chance to see this myself. I'm rather busy at the moment. I fight corrupt and negligent doctors in the real world all day, every day, presently. And yeah, if any movie people out there are watching this, I would like to make a film based on my medical experience. I've written up the first half of my injury, and it's a couple hundred pages long. Proofread and edited. Was going to publish this as a book, and this would be a great basis for a screenplay. And then you also hear that he reads the reports that were given to me. And yeah, if you go to see my other videos, I was misdiagnosed in many of these visits. And I pointed this out to him. Again, a good doctor who does an MRI review. Is he looking at the MRIs, the actual images, or is he looking at what the doctor wrote out? Because doctors who are just repeating the words of other doctors, that's not what practicing medicine is about, all right? Real doctors out there, they apply their skill that they went to college for all these years to obtain these degrees, to present to the Department of Health of Florida and obtain these medical licenses that they then go on to use as their profession and make millions of dollars every single year. Okay, so this doctor, he did not do his job properly. Injuries are present in these pictures. You'll hear he tries to argue with me, a patient who knows otherwise.
I'm Dr. Deukmedjian.
Hello.
I looked at your MRI, and I know it's a bit old, but I had a chance to take a peek at it. What's going on? Are you having neck pain?
Yeah, and a lot worse than that. Okay, my hand, it's on my left side, upper area of my neck, lower skull.
What's bothering you? What's hurting you?
Okay, I have for the last 4 years intense pain on the left side of my neck. I cannot turn my head left or right easily.
Take your collar off and put your finger exactly where it's hurting you so I can see it.
Okay. Yeah, give me a minute because there's a lot of pain here. Okay. Yeah, I can't really turn my head so easily.
Yeah, go ahead and show me exactly where it's hurting you with one finger.
Okay.
I need you to turn more. I gotta.
Okay.
Don't look at me. I need to. There we go. That's what I need to see.
Right here.
Left side.
Left side, yes, sir.
And just turning to the side hurts like heck.
Moving my head out of a very limited range of articulation is a lot of pain.
What about turning to the right side? No problem?
I cannot turn left, right, up, or down very easily. There's a lot of pain.
So much.
Yeah.
I think I know what's wrong.
Did you take a look at those images?
Oh yeah. I'm looking at them right now. Sorry, I'll share my screen with you. I apologize.
Yeah, I got the images here too that I can share possibly.
I don't need you to share with me.
Okay.
I have them right here. This is your MRI right here.
Okay.
All right. So the good news is you don't have any herniated disc on this MRI that I can see. Now your pain is coming up from C1, C2.
Yeah, it's around. I think it's around. Okay, could you go back? Yeah, you go. Anyway, you just passed that area where I believe there's a serious issue. Right here.
Okay.
Well, can you go? I wish that I could.
Here?
Okay, right there, and then it's below my brain. Can you see that?
Right here.
Yeah, that area to the left of your mouse cursor. Okay, now you moved out of the range. Okay, yeah, right there, and then to the left and up of your mouse cursor. That area right there, and you can see that the injury, it also kind of covers.
What injury are you talking about?
Okay, I'm talking about this broken piece of bone that came off the underside of my skull.
No, I don't think you have a broken piece of bone going on.
Is it possible for me to share these images, because I can show you otherwise? In 2018, I believe I broke the underside of my skull, and you can see this in these pictures.
But listen, you wouldn't see that on an MRI.
Yeah, you can. You can see also the side effects, because I broke the underside of my skull and I went into this emergency department. I was misdiagnosed, and then after several months passed, the area became infected. Do you have that other MRI? The MRI?
Listen, it doesn't matter because I don't treat this kind of stuff.
Okay, well, it's in the area of my spine, sir. You're a doctor, right?
I'm a doctor.
Okay. I wish that I got the pictures printed out here.
It doesn't matter. There's nothing I can do to help you in this area.
Okay, but yeah, it's going to be in the area.
Yeah, again, I'm not an expert, and I don't deal with this area, so I'm not going to address it with you.
First, second vertebrae. You deal with that issue, don't you? You can see an injury in the area. Can you bring up the overhead imagery, please? Of the go to the brain or the yeah. Okay, this one. Yeah, and I gotta get to
the top right there.
Okay. Can you bring? There's some other pictures in here.
That's what I have.
Okay, you got to bring up the.
But if this is below your brain, I'm not dealing with that. I already told you that.
Okay, well, yeah, it's actually in the area. I think I broke the underside of my skull. There may be damage in that area.
Deal with that part. You're gonna have to go see a neurosurgeon that does.
But okay, you can look at these pictures. Can you tell me if there's an injury or not?
I cannot. No.
You cannot.
I'm not. I don't deal with that area.
Okay, well, you can.
What does the report say?
And what does the report say? Well, you're the doctor. I wanted to ask you, sir.
Yeah, this is an MRI phone consultation for the spine.
Okay, can you go to that area?
Just do brain stuff.
First, second vertebrae in the cervical column of my neck. And I've got an injury there that you can see.
It doesn't say anything here about first and second.
Okay, can you bring up...
The MRI of the cervical spine is essentially unremarkable.
Okay, you're going to have to look at the pictures. I was misdiagnosed.
Yeah, I'm not going to help you with that. That's not what I do.
Here,
I do a spine issue.
if you go up to this area where you were on the profile, you can...
We're done.
We're done. We're not done. Well, I'm not done because I got a real serious injury I need to have looked at. Right here. There's my brain. There's the cervical column. T1, T2. I got a broken piece of bone under my skull.